Hello, this is Gary Crowley with DoItYourselfJointPainRelief.com, and this is video 3 for Sacroiliac joint pain relief. And what we're going to do in this video is 3 things. Release your hips that can be yanking on that tailbone or your hip bone and affecting that SI joint. We're going to release any tight tissue on your tailbone, and we're also going to release your hamstring a little bit. So in step 1 we did your vastus lateralis, your IT band, your tensor fasciae lata on both sides. In step 2 we did your iliacus and your psoas on the front of your back on both sides. And now we're going to do all the muscles I just mentioned on both sides. So the release of your hips, one of the most effective tools for releasing your hips is a standard old tennis ball. And basically what you want to do is you want to take this tennis ball and you want to find, if you start sitting, you want a decent cushion but not too much cushion or you'll lose the ball in it. But if you start basically at the tip of your tailbone and scoot out a little bit so you get some muscle tissue in there, you will start finding some tender spots. And again, all this tissue here, here's my tailbone, here's my femur, all this stuff is tissue. All this stuff is muscle tissue. And if it's tight, it'll yank on your tailbone, it'll yank on your hip bone, and it'll affect that SI joint. So we're going to take this ball and we're going to sit on it right there. And when you find a tender spot, you're going to make your leg move. Basically, we're doing a press hold move by using a tennis ball. And if you haven't been to the techniques page, go visit that for a minute so you can know exactly how to do these techniques so you can be highly effective in setting yourself free from pain. And if you go about halfway up and then probably do the other side halfway up, and again my left side tends to be a little tighter than my right side, so it always helps to release any tension in your body. So if you get you very basically as much pressure as you can relax into is what you want to do. And there it goes. There it goes. And then when you get up to probably the upper half of your hip, you probably want to start getting more kind of this type of position. At least for me, that's a good amount of pressure, but again, I can relax into it. And you just want to make sure that tissue is staying on one spot on that ball, and then you make that tissue move under the ball. See, that's a pretty good spot on me. So I'm just going to put some nice conscious motion into that, and there it goes. Let's go. Now it doesn't hurt. And then again, you want to do the other side as well, because sometimes it's the opposite side that's tight with this SI joint pain. It's actually pulling your tailbone almost out of position from the other side. So you want to do both those sides. But that's how you get all that free, and just play around. And if you press on it and you make it move, it will release. And these are big, strong muscles, so you want to make sure they're free. So next we want to make sure that your tailbone and any of the, especially kind of the tendinous attachments from the muscles, make sure they're not inappropriately tight. So again, we're going to lay down. We're going to put that tennis ball probably on the lower, maybe right side, and feel where it's tender. If you find a nice tender spot, then basically, with as much weight as you want, move your leg so that tailbone moves just a little bit under that ball. If you want more weight, you can kind of scoot up on your elbows and get it, like right now I got all my body weight on that ball. And your tailbone's pretty sturdy, so you can get on there. If it's tight, you'll feel it. Also, I probably couldn't do it as much if it was tight. Let me find a spot. So there's a little tender spot. And actually, you really gotta, well, there it goes. Yeah, and there it goes. If you stay on it, keep that ball on that spot and move that leg, it will let go. So you do that on both sides of your tailbone, release any tender spots you can, and that means there's going to be as much freedom so that tailbone can then have the freedom it wants to move. And then lastly, I want to show you how to release your hamstring, because your hamstring basically attaches to these sits bones, those bones you feel if you sit on a hard chair. And there's stretches. I have a nice active hamstring stretch on the main lower back page, which I think is video. I think it's video 3, step E or step D. But I want to show you how to manually do it, because sometimes manually getting in here is better. So basically, lay on your back. This is your hamstring. It attaches to that sits bone right there. And if you just keep your leg at about 90 degrees to the floor, and then we're going to do a hand on hand, press into this tissue right, there's my sits bone, this is where it attaches. But press into that tissue, and if there's any tender tissue here, pull on, press with this hand into your fingertips, and then just straighten and lower that leg, straighten and unstraighten that leg, and you'll feel that tissue move under, like I'm a little tight there, and there, it just starts letting go. And that's a really nice way, because sometimes, you know, this hamstring can be yanking all the way down and pull that SI joint out a little bit. And then if that's a little too difficult for you, then you want to take a ball. I found tennis ball might not quite be enough. This is from a baseball pitching machine. It's a hard plastic ball. You can have baseballs, or softball is probably a little too big, but I like this one. And again, just like you did with your hip, if you sit on that hamstring, basically right where it attaches to your sits bone, and then you find a nice tender spot, and then all you have to do is straighten and bend that leg, and then you'll feel that hamstring move under there. And this actually is a wonderful, I mean, honestly, this is probably the easiest way. I know I just showed you the manual way, but some people, their hands aren't quite strong enough to, hamstring's big muscle. Some people don't have the strength to get in there, but that is a lovely way to release your hamstring. And you can even go down. If you get away from the attachment, you might even need a softball in there. Yeah, see, softball's a little blunt. It's a little too big. So you probably need a harder surface. Well, that'll do it. I got a baseball in the belly there, and I'm having to put a fair amount of my body weight on there. But that'll release it, especially if you got really tight hamstrings and you don't feel like you stretch effectively. A lot of people stretch. Not as many people stretch effectively. So, you know, stretching effectively is the key, and it's tricky sometimes, especially if you're not in the habit of doing it. So there, that just released my hamstring nicely. So that's a baseball. So never underestimate the power of using your balls. And but that is video 3, and so now self-assess. Notice if step 1, 2, or 3 seem to release your pain the most. If you still have any residual pain, notice what techniques gave you the most release, and or what ones seemed the most difficult. You might want to go back to those and release those, because they're probably the ones that will be the magic bullet to release your pain. And yeah, just take your time, stick to it, and once you know your individual system, you might just go, yeah, I released my vastus lateralis and my iliacus, and then I don't have SI joint pain anymore. So it is worth the time, and I thank you for your time, and I look forward to hearing how it goes. Thank you.